Hi, everyone. This is Graham Litchman. I'm a practicing dermatologist out in Las Vegas, Nevada at Vivida Dermatology, where I'm co-director of clinical trials, but seeing patients every day, so in the trenches with all you guys. And I wanted to talk to you a little bit about how I use a particular biologic medication called risankizumab for psoriasis. And I have an exciting patient case for you guys today. And I'm here talking on JCAT podcast. Very exciting. So glad that you're tuned in. And hopefully, what we talk about today can be helpful for you in your practice. So, here, just to kick it off at first, let me just give you a little bit of background about this patient. This was a 54-year-old female, otherwise healthy, but really had been struggling with her psoriasis. It just had not gone away with conventional treatments. She had been through the rigmarole of trying the topical medications, having it get a little bit better, but then come back flaring just as bad as it did before. Unfortunately, before seeing dermatology, she had been treated with systemic steroids, and we all know what that does. And unfortunately, she had to experience that really terrible rebound flare. So she was really looking for something new. And we talked about biologics, and I went to ramp up into my whole big discussion about the pathophysiology and the MOA and everything. And she said, well, actually, I've been on biologics before. I said, okay, hold the phone. What are you talking about? She said, I've been on another drug and I don't remember the name, but I know it's not the one that you're talking about. And so we started to discuss and try to figure out it wasn't in her file. And we started to think about, okay, how many times did you take it? For how long did you take it? How did you feel on it? And eventually, as we're getting through it, we had a guess of what it was. And then lo and behold, I had my medical assistant come into the room and they said, I found it. This was the on the requisition. This is what she had. And I was like, okay, great. I said, you know what? That's a completely different class. That was an IL-17 class. And what we're talking about today is an IL-23. So she was really excited for this potential new medication that was in a different class, worked in a slightly different way, but hopefully achieved an even better result. And so as we got through it, she wanted to know, most importantly, how often she'd be taking the medication, what were the side effects of the medication potentially, and then, of course, what she could expect. And so as we unpack that a little bit, and I implore you to do this with your patients as well. Just take another extra 30 to 60 seconds just to give them a brief little background. And I know it's so tough in the day when you have a huge census of patients that you have to see, but just giving them a brief of the MOA and what they're looking to expect really does a lot for the patient. Because at the end of the day, if you can underpromise and overdeliver, no matter what you're trying to do, they're going to be really excited with their results and they're really going to be happy with you. And so one of the ways that I do that is I briefly explain the mechanism of action and what they are to expect in terms of side effects, if there are any, and most importantly, what are they going to expect in terms of how well they're going to be doing and in what time frame. So backing up, we talked about IL-23. She knew a little bit about IL-17 already, so she kind of understood what we were talking about with chronic inflammation and really dampening that response. And so she didn't need us to go too much into that. But what she did want to know was, were there going to be any side effects? And I could assure her that with risankizumab, people are doing very well. The most common side effects, if you're looking at the clinical trials, might be like a little nasopharyngitis, headache, something like that. But guess what? When we're looking at those compared to the placebo groups, they're about the same. So those are happening in both groups. We know that they're happening with the majority of people who are going through flu season that might get a little cold. This is not what we're worried about. So it's a very well tolerated medication. And then the next thing she wanted to know, she's like, well, you know what? I had to take the other one every 2 months. Am I doing the same for this medication? So guess what? You're in luck. You only got to take it quarterly. So it's basically an injection a season. Summer rolls around, time for a unit injection. Fall rolls around, one more. Then we have winter and spring, and then you're done. You've completed a full year, and you're going to do great while you're on it. So she's really excited about that. When we got her on, I told her we're not going to see results immediately, although some people may. So I don't want you to be looking within that first 4 weeks for this drastic change. And so she was really happy to know that because the last person that she had been to had told her that it's going to happen immediately. And so when she came back at 1 month just to make, I always bring back my patients at 1 month with chronic inflammatory disease on biologics just to make sure that they're doing okay. And then the other thing I like to do, and this is a pearl for you guys, is that if your schedule allows for you to bring them back, you get the opportunity to do two things. One, you just get to check in. How are you doing? And this allows you to kind of gauge, have they made some improvements? And in that case, it's just a high five and we're all doing great. Or maybe they're not quite there yet. Maybe things are being a little bit slower to act. And then you can hold their hand a little bit and really guide those expectations. And so that's what I always do. She came back. She said, no, nothing has really changed all that much, although she was feeling a little bit better overall, but the plaques were still there. I said, don't worry. We really want to see how you're doing at 3 months. And that's where the second follow up came in. She comes back and more than 3/4 of her plaques had simply just melted away. So she was super excited about this. And this was our high five visit. And so that's what you can expect for this type of medication where you're dosing it on a quarterly basis, and that 3 month period is when people are really doing well. Now, some people do well early. Some people will come back in 4 weeks and said, oh my gosh, like this thing is 50% better. But just be careful about how you explain that and how you set those expectations. So to round out this case, our female was doing very well at the 3 month period. She continued to do well at the 6 month period. And now she's coming up on a year and she's staying about the same. She maybe has about 1% of her body surface area that has a little stubborn spot. And we use a non-steroidal topical, and she does great with that. And we've been able to clear her with the samples when she has that little bit of a flare. So she's very happy with her medication. And most importantly, she's happy that she doesn't have to take so many injections. And I think for a lot of people, if they can kind of make the injections less part of their lives, make the pills, make the creams less a part of their life, then they feel a little bit more normal. And I think at the end of the day, when people are suffering from chronic inflammatory disease, the one thing that they really want is that semblance of normalcy. They just want to feel like there's nothing wrong with them. And to be honest, I feel like we all want that. I mean, if we were to bring ourselves back to middle school when we're just feeling so terrible about our confidence, about how we feel in our bodies, the last thing we want to do is to stand out and be abnormal, so to speak. And so I think everyone is really kind of looking to establish that new normal, have a little bit of more control over their bodies. And with a drug like risankizumab, that's something that you can definitely offer them. And so I definitely want you to go out, talk to your patients about lots of the different options. This may be the right one. This may not be the right one, but certainly if you haven't tried it yet, it'd be a great thing to get into your armamentarium. So thank you so much for listening to me. Hope you learned a little something, and come back to JCAT podcast for another exciting one next time it's in the queue.